Ovarian cancer is one of the most feared of all the gynecologic cancers, and it being September, it's Gynecologic Cancer Awareness Month. And so let's talk about ovarian cancer because unfortunately, the symptoms are silent. The symptoms are subtle, and it's often detected when it's at later stage disease. But there are some things we can do to take back control and try and detect it earlier, looking at the risks, how to modify them, what increases, what decreases the risk, and also hopefully decrease the chances of you or a loved one developing ovarian cancer. Hi everyone, welcome back. My name is Eric Schmidt. I'm a board certified OBGYN, minimally invasive gynecologic surgeon. This video is part of a series which we're trying to raise awareness, raise money for gynecologic cancers. It's September, which is Gynecologic Cancer Awareness Month. And so there's a link below if you are able to donate, if you are able to help give, so we can further fund research to hopefully defeat a lot of these terrible GYN cancers. This is day number 4 in a 30-day series where I'm posting a video every day to bring awareness. Hope you enjoy this video, and back to it. In the United States, there's about 20,000 or so ovarian cancer cases diagnosed every year, and unfortunately, approximately 13,000 deaths. Now, why do I say ovarian cancer is one of the more concerning or scary cancers in the GYN cancers? And a big part of it is that there's no screening test. When we talk about cervical cancer, which we did in a couple of videos ago, there's a screening test, the pap smear, HPV testing, and we can detect those early changes that happen. And for breast cancer, we do mammograms and other imaging to detect these early changes that can lead to more advanced disease later on. Ovarian cancer, we don't have that test yet, unfortunately. And so some really smart people are working on this, but as of right now, we don't have a great screening test for ovarian cancer. And that's part of the reason why approximately 70% of people diagnosed with ovarian cancer are already at a later stage disease, like stage 3, stage 4. And often for early stages of ovarian cancer, there's not a lot of symptoms. And this is in complete, opposition to endometrial cancer, where we just talked about that one in the last video, but there's the symptom of bleeding in almost every single person that has those precancerous or cancerous changes of type 1 endometrial cancer, they have bleeding. And for early stage ovarian cancer, we don't have a lot of the symptoms to detect it that way. But let's go over some of the symptoms that someone might have if they potentially have ovarian cancer, so we can hopefully get early detection. Now, a lot of these symptoms are vague. A lot of these symptoms are subtle. And so the symptom of bloating is the first one, abdominal bloating. Again, so many other things that are much more common cause bloating, whether it's the GI system, whether it's things like endometriosis. A lot of things can cause bloating. However, if someone is having unexplained bloating for whatever the reason behind it, you should get it checked out. Especially if it's a new symptom for you, nothing's changed, especially if you're someone that's potentially in their 50s, 60s, 70s, you should get this checked out. It could be a symptom. Another symptom is the feeling like you can't eat like you used to. You can't, whenever you try to eat, you get full quickly. Early satiety, we call it. And this could also be an early symptom of something going on within the abdomen and pelvis. The body can sense that something just isn't right. The GI system, for a lot of these peritoneal cancers, like ovarian cancer, fallopian tube cancer, all those things touch each other in the abdomen and pelvis. And this could be an early symptom that something just isn't right. Kind of going along with these two, unexplained abdominal pain, unexplained pelvic pain that is out of nowhere. Again, no matter the cause, get it evaluated. Potentially we could detect an early change, leading to detecting hopefully an earlier stage disease. And also likely because it's in close proximity, if somebody is having unexplained bladder changes, if somebody is developing an adnexal mass, meaning a mass by the ovary, the bladder is also very close to that area. And so someone can have urinary symptoms, whether it's feeling like you can't hold your bladder like you used to, some irritation, or increased frequency potentially. Again, these symptoms likely have a more benign cause to them. They're very common symptoms. However, they always warrant being checked out. And if you're having these symptoms and you detect an early cancer, survival rates are almost 90%. Versus if it's potentially detected later on, survival rates for ovarian cancer are much lower, probably closer to 30 to 40% for stage 3 or 4. Let's talk about ovarian cysts for a second, because I think a lot of the fear, rightfully so, from ovarian cancer and the fact that we don't have a lot of ways to identify it is leaked over to ovarian cysts. It's some of my more popular videos where people are worried about their ovarian cysts, potentially because they're worried it could be precancerous or cancerous. And more often than not, a very small percentage are actually cancerous ovarian cancer. And there's a lot of different things we look at to help make this determination on what's concerning and what's not. Number one, the ovaries are supposed to make cysts in premenopausal women on a monthly basis. It's supposed to grow, develop an egg, release that egg, and then that cyst forms the corpus luteum. And so there can also be what we call these functional cysts, physiologic cysts of the ovary, and that's normal. But sometimes they can look a little bit different and definitely warrants further investigation, potentially further monitoring. And there's a few different ways we can monitor further. One, repeat ultrasounds. Two, and we do have blood tests to help increase or decrease our suspicion of things like ovarian cancer. We classify cysts in a couple different ways. If you're reading your ultrasound report and you see something, say a simple cyst, that is likely something that is more benign. A simple cyst is likely just an ovular-shaped cyst with fluid in it, physiologic fluid. Sometimes these can be small, 2-3 centimeters. They can grow, give or take, 8, 9, 10 plus centimeters. However, if they are very simple appearing, meaning nothing in them besides fluid, not a lot of abnormal blood flow, they're likely benign with a high level of certainty. However, if some of these cysts have a little more things in it, like septations, abnormal blood flow, nodules, it definitely increases our suspicion. Again, chances are it's still benign, especially someone premenopausal, but it definitely warrants further monitoring and even further potential lab tests to increase or decrease our suspicion of things like ovarian cancer. Now, there's a whole different aspect to some cysts like pain, which again, I'm not discussing here. That's for other videos. We have a lot of other videos on ovarian cysts. What's called a CA-125 blood test, or cancer antigen 125, is a protein that's sometimes released in the body when there is something going on. And if somebody has an ovarian cancer, in 85% of the time, this will detect it. There are also other blood tests. There's HE4, there's AFP, there's CA19, there's CEA. There is actually a few different types of ovarian cancers. And so if you notice your doctor orders a bunch of these tests, the main one we look for, which is for epithelial ovarian cancer, which is mainly what we're talking about today, is the CA-125. But these other tests sometimes can be helpful for identifying other types of ovarian neoplasms too. All right, now let's go over the different risk factors. What increases somebody's risk for ovarian cancer? What decreases somebody's risk in ovarian cancer, okay? First one is age. By far, vast majority of ovarian cysts are seen in people. The average age of epithelial ovarian cancer, which again, what we're talking about mainly today, is 63. And most of these, again, diagnosed 50s, 60s, 70s. So that's the biggest risk factor. Especially what we say postmenopausal, is usually the time where the ovaries are done producing their ovulatory cysts. And so if we see anything abnormal growing on them, it definitely warrants investigation. To go along with the age for a big risk factor, if somebody's had a family history of ovarian breast cancers, and again, specifically things like the BRCA, genetic mutation or genetic hereditary syndromes. So if there's breast cancers, ovarian cancers, colorectal cancers in the family, which would kind of correlate with Lynch syndrome. We talked about that, Lynch syndrome, for increasing risk of endometrial cancer in the last video. But these all increase somebody's risk. If someone has BRCA1, they have about a 44, up to a 44% lifetime risk of developing epithelial ovarian cancer. For BRCA2, it's low 20s, 23% lifetime risk of developing it. And so that's actually pretty high compared to the general population is about a 1.3, about 1 in 70 people develop ovarian cancer. And why do these ovarian cancers develop? And a few of these next points will kind of play into that. People think that with more ovulation, more disruption of the capsule of the ovary, potentially the more that it's damaged, the more that it increases somebody's risk for ovarian cancer. And so, for example, if someone hasn't had any pregnancies before, they have a slight increased risk of ovarian cancer. Thought is they've ovulated through their menstrual years without a break. Breaks come either on suppressive medications, like hormones, like birth control. If someone's pregnant, they're not ovulating, and often if someone is breastfeeding, at least they're not ovulating for a little bit. And so, again, people who haven't had pregnancies before have a slight increased risk of ovarian cancer. Again, going along with the risks of early menses, so first menses at a young age, or early menarche we call it, that is a risk factor, and late menopause is also a risk factor. So longer menstrual years, more ovulations through that time. And actually, might surprise people, but endometriosis increases somebody's risk of developing some of the ovarian cancers. It's a specific type and it's rare. It definitely doesn't increase your risk like a lot of the other factors we talked about, but this is clear cell and endometrioid type cancers are increased for someone that has a history of endometriosis. And this probably doesn't come as a surprise, but cigarette smoking does increase somebody's risk. Okay, let's talk about the protective factors. So what decreases somebody's risk of developing ovarian cancer? We talked about it. If someone's had pregnancies before, again, not as many ovulations. If somebody's breastfed for greater than 12 months of their lifetime, they decrease their risk of developing epithelial ovarian cancer. If somebody has a tubal ligation done, we're going to talk about this in a separate video, but doing a tubal ligation decreases somebody's risk of ovarian cancer. And I didn't touch on it too much before, but the thought is that the peritoneum layers, the fimbria of the fallopian tube, the ovary, they all kind of originate the same. A lot of those cancers, the end of the fallopian tube might actually be the original point of a lot of these early cancers of the ovary. And so we'll talk about that again in a separate video, but removing that decreases somebody's risk. Okay, so we talked about the different risk factors, what increases, decreasing risk. So if there's options on there to modify, you should do that. Cigarette smoking, stop doing that. Having children and breastfeeding are protective, but this isn't a thing where we're going to say do that just to protect yourself against ovarian cancer. But sometimes people could choose to be on things like birth control pills or an IUD. Actually, both of those decrease somebody's risk of ovarian cancer, or getting a tubal ligation done can decrease somebody's risk. Now, there are very specific recommendations when it comes to people with the hereditary cancer syndromes, BRCA 1 and 2, Lynch syndrome, whereas if somebody reaches a certain age and they've completed their childbearing, they recommend removal of the ovary and the fallopian tube. And as we're going to talk about a lot in the next videos, maintaining a healthy weight, low inflammatory foods is actually going to go a long way to decrease the amount of the cytokines, inflammatory markers that make it so cancer can develop quicker. So again, healthy diet, exercise, good sleep patterns, decreased stress is all going to improve someone's or modify somebody's risk too. So if you have any questions about these in particular, comment below. Again, this is a 30-day series where I'm posting a video every single day for 30 days. I usually post only about 40 videos a year. So this is a big change for me as I'm working as a full-time OBGYN and doing a lot of other things also. So I appreciate you following along, liking the video. And again, this is all for a fundraiser to raise money for cancer research. The link is below. If you're able to, please, any little bit helps, and it doesn't have to be a huge amount if you choose to donate. The GoFundMe link is below. Thank you very much, everybody. Have an excellent day.